So good morning. Welcome to Pediatric Grand Rounds at the University of Alberta. For those of you who don't know me, my name is Sarah Forgy. I'm the academic chair of the Department of Pediatrics here at the University of Alberta. And I would like to acknowledge that we at the University of Alberta are located on Treaty 6 territory, and we respect the histories, languages, and cultures of First Nation, Métis, Inuit, and all First Peoples of Canada whose presence continues to enrich our vibrant community. So we're very excited. We have a multi-site presentation today for our Pediatric Grand Rounds involving both Calgary and Edmonton. And the title is Supporting Pediatric Health Outcomes Research. And we have many presenters that we're very excited to hear from. So we have Dr. Karina Majasiks, who is the Facility Medical Director for the Stollery Children's Hospital, Dr. Jennifer McPherson, who's the Facility Medical Director for the Alberta Children's Hospital in Calgary, Dr. David Johnson, who's the Senior Medical Director for Alberta Health Services Maternal, Newborn, Child and Youth Strategic Clinical Network, Dr. Finlay McAllister, who's the Scientific Director for the Alberta Spore Support Unit, Dr. Todd Alexander, who's the Associate Director for WICRI, which is the Women and Children's Health Research Institute, and Dr. Susa Bensler, who's the Director of ACRI, which is the Alberta Children's Hospital Research Institute. So just to remind everybody, after the presentation, we will be putting in a link for our percolator. Please join us for some coffee and some connecting. And we have invited our speakers. So if you have any questions that are lingering from Grand Rounds, we can connect with them afterwards. So I will also quickly introduce some of the others who are on the tiles in our presenter group. So we have Dr. Jess Foulds, who is the director of our Pediatric Grand Rounds and also our program director for the General Pediatrics Residency Program. We have Dr. Liz Rosalowski, who is our Associate Chair, Faculty Development. And we also have Lynn Yang, who is the amazing organizer who keeps this all on track. Thank you, Lynn, for keeping our Zoom going. So I'm going to hand over the microphone now to Dr. Karina Majasiks, and we look forward to hearing your presentation.
Thank you, Sarah, and welcome to Grand Rounds. I'm quite excited actually to be able to have these Grand Rounds talking about how we support pediatric health outcomes research at both Alberta Children's Hospital and at Stollery Children's Hospital. As Sarah said, these are joint rounds. They're joint between the University of Alberta and University of Calgary, Stollery Children's Hospital, and Alberta Children's Hospital. And I have a co-host who is Jennifer McPherson, who is my counterpart in Calgary. And she, as you heard, this is a very joint initiative with multiple speakers today, but also multiple stakeholders and multiple supporters between Mincys, Alberta Spore, WICRI, ACRI, Alberta Children's Hospital, and Stollery. We're many people at the table, but we all would like to see children's health outcomes improve. And that is why we are joining our efforts here today. Next slide, please. This is the conflict of interest and disclosure slide. I think we can move on to the next one. So the objectives are that we should be able to describe or should be able to measure how we measure outcomes of system changes on patient health outcomes. How we can identify the resources and supports that are available for us to look at this in pediatrics, and then how we can relate our own experiences and our own questions to what we are able to use, how we are able to use patient outcomes to improve the healthcare we provide by using health system data. Next slide, please. So the healthcare system, or how we deliver health care, is actually changing quite rapidly in our time. Historically, it is one physician, one patient at the time, some notes put into paper form on a chart that gets filed someplace. And it very much functions not as a system, but as an individual physician to one individual patient. there's been a rapid move in our province and in many other healthcare organizations to now move this to electronic health records, where we get data on large groups of patients rather than just one patient at the time. We have also moved from being one physician and one patient to being multidisciplinary teams or divisions and sections where we actually have multiple physicians looking at one patient or groups of patients. So our practice habits or our practice structure is changing. And the last change we've had with this that occurred really rapidly through the pandemic, although we did have technology for it before, was that we couldn't see our patients in person. So we saw them virtually through Zoom, through telephone, sometimes telehealth. And so we've changed how we did our practice of medicine. But with that change, we looked at surveys to see what was that experience like, and patients liked the convenience of being able to be at home and talking to their doctor and their team from home. But the question that we raised after that, either through the service of the providers or in hallway conversations, have been: do we actually provide good health care by doing this? Are the patients better, or are we not providing good health care and we're just opting for convenience and what appears to be comfort? Next slide, please. So through these questions, we started discussions about how do we get our healthcare outcomes, and Jennifer is going to talk about that.
Thanks, Karina, and thanks again for reaching out. I think I just like to say again how important I think this is that our two sites are coming together. But as we thought about these changes, and in particular the change related to using virtual health, we have to ask ourselves, yes, it might be more convenient, but what is the outcome? Are there, reduced hospitalizations? Are we getting to a diagnosis faster, or is it the opposite? Is it taking us longer? What about medication management and all the other things that are listed on that slide? So I think our conversation started with the impact of virtual health, but I think there's this whole concept that we're going to be talking about today from hearing from the other speakers is going to be to take any one of these questions and ask ourselves as frontline clinicians, do I have the data that I need to answer that question? And if not, how do I get it? So I think we're going to hear some really helpful information that's going to take us down that path that hopefully as frontline clinicians, we can answer some of these questions and ideally pool our resources. So if we think at ACH that we have a strategy that might be effective, let's double our data and combine our look at this question with our counterparts at Stollery. And maybe it's the choice of a medication we might use or any of these other things. So without further ado, I'd like to move on to the next section, and that's Dr. David Johnson, who's going to talk about the role of Mincy. Thanks, David.
Great. Thanks, Jen. Probably the most important point that I'll make today is to echo what both Karina and Jen have said. We really want to get each and every one of you enthused and motivated about improving the health outcomes of the children you care for. In medicine, as you know, we're trained to take care of each one of our patients one by one, considering their unique stories, really a microscopic perspective. Unfortunately, we don't receive much, if any, training on how to ensure our patients are cared for in the aggregate, the macroscopic perspective. That's really a shame. I think many of you would agree with me about that. But for those of you who don't have expertise in QI or knowledge translation, this grant opportunity is really intended to help you gain experience and expertise in these macroscopic fields, to be able to understand how best to improve the healthcare system to take care of your children. Maybe you're saying to yourself, I just simply don't have enough time in my day. I would argue that if you truly care about your patient's well-being, you should embrace the Tao perspective, balancing your time and attention so that you spend as much time thinking about how to improve our system as you do about caring for your children one by one. Next slide. So how can we at Mincys help you achieve these goals? So unfortunately, Mincys staff and our budget is quite limited. So we can't offer to drive your projects or provide you with funds to conduct to dive into your ideas. But what we can provide is lots of advice, feedback, guidance, encouragement when you need it. We can also direct you toward funding sources. All Mincys projects actually have to obtain competitive funding in order to go forward. So just important for you to know, it's the same thing we have to do when we're really trying to get funds for our own projects. We can help you facilitate data analytics support, and we'll be talking quite a bit about that later. We can help link you with statistical and health economic support. And then also important, once past the post, by that I mean, for example, for the Prius competition, where all projects first have to come through the individual SEN that they're most related to. Once we identify which are the best grants, the ones we think are most competitive, most likely to get funded, then we'll be on your side, working with you hand in hand to really try to improve your projects so that children, projects that really focus on children get their fair share of competitive funding. Next slide. So how do you go about thinking about doing the background work necessary for improving health outcomes of your patients? So really, the clear message here that in order to be successful, a considerable amount of thought and work are required. And so doing that will optimize your chances at securing funding for your project, but even more importantly, actually allow you to succeed in improving your patients' healthcare outcomes. Because sometimes how to go about doing it really takes a lot of thought. And if you don't do that in a really careful way ahead of time, you can end up spinning your wheels and not achieving your goals. So what kind of disease? My perspective is, first of all, that it is important to focus on a particular problem. That's really how we affect change for our patients. But which kind, whether it's a very common problem, whether it's an uncommon problem with severe outcomes, choose what you're passionate about. And ideally, since we want to do this as a team collectively across the province, hopefully you have colleagues as well that share your passion. So you need to know what the gap in care is, and that might stem from your intuition, your clinical experience day to day. It might come from the published literature, existing data from Alberta. Then the question is, what innovation? And I mean that in the broadest sense. So that could be, it could be something like clinicians aren't managing patients based on best evidence. So that's the innovation and effort, use of pathways, etc., to really get clinicians to use evidence optimally. Maybe they don't take time to educate their parents adequately, or the system doesn't, or there's a new treatment on the horizon. You need to think about what needs to change to allow that innovation. And so it could be a change in the way your colleagues practice, how it's delivered, even a truly game-changing test or treatment. But I'll just emphasize, we're in a very tight economic environment right now. And at this moment, selling to do less is easier than selling to do more. So last of all, what kind of sweat and tears do you need to put into it? Obviously, you need to dive into the evidence, do deep dives, think carefully about what the problem is. But these days, in order to be really competitive, you really need to understand the patterns of care for your patients in Alberta. And that's what we're going to be talking about for the next little bit. Next slide. So how to get Alberta data. So there are two routes. For those projects, those groups that have a lead that's from Edmonton, it will be through the SPORE data platform. And Finlay McAllister is going to be talking next and give you some details about how you do that and what kinds of things that you can obtain there. If your nominated PI is from Calgary, you can go through the ACRI Research Data Analyst. Contact me and I can direct you appropriately. For those who know Nicole Romanoff, that's the person you go through, and she will direct you to our data analyst. I'll highlight though that the data itself is the same regardless of which route you go. The skill set of the data analyst are pretty much the same. And so whichever way you go, you'll get full access to the data and good support in doing that. Next slide. And so the last thing I want to highlight is that we at Mincey really want to facilitate this initiative. We really want to help make flower a lot of projects that are really focused on improving our children's healthcare outcomes. And so myself, Deb McNeil, who's the scientific director, Saya Crom, who's the assistant scientific director, are willing to help you in any way we can. In particular, I'm very happy as part of this project to mentor individuals, groups, in terms of how to navigate this initiative and improve your applications in any way I can. So I'll turn it over now to Finlay.
Thank you, David. So thanks for the invitation to speak today. I'm from the Division of General Internal Medicine. So I look after patients significantly older than your guys' patients, generally probably their grandparents and their great-grandparents most of the time. I'm going to talk to you about the ABS4U, or the Alberta Strategy for Patient-Oriented Research Support Unit. I was the data platform lead for the first 5 years of ABS4U, and I want to acknowledge that there were significant contributions from pediatricians and the Department of Pediatrics in ABS4U 1.0. So Lisa Hartling was involved with the ARCH group, and Lisa led the KT platform for ABS4U for the first 5 years. And Lawrence Richer led the Pragmatic Clinical Trials group for those first 5 years. So for the next 5 years, because I missed the wrong teleconference, I ended up getting appointed as scientific director for ABS4U. So if we go to the next slide, Everything I'm going to tell you today can actually be found on the website, and it's www.absporu.ca, and you'll see a nice picture of the Rocky Mountains, and you'll see at the top the various components that are available within AbsporU. Today we're talking about data and services, but there are also things to highlight under capacity development, patient engagement, and support for knowledge translation, which is in AbsporU 2.0 being led by David Johnson. Next slide, please. So what is the Alberta Sport Support Unit? Well, it was established in 2015 with funding from CIHR and Alberta Innovates Health Solutions at that time. And we've applied for a renewal for 2021 to 26 from CIHR and a number of other partners, including Alberta Innovates, as I'll show in a few slides. And we really are part of a network of provincial and territorial sport units and also national networks. Next slide, please. So first thing I want to emphasize, like David talked about for Mincy, AbsporU provides infrastructure support. So we have about 50 staff, 12 of whom are actual analysts trained in using administrative data or performing analyses. But we can't provide operating funds. We will help people get funding. We provide letters of support. We provide advice for grant applications. And we'll come into it in a little bit later, the amount of co-charge or the co-pays for primary investigators going through the Alberta Sport Support Unit. This slide is just to show that there are 9 provincial sport units across the country, 3 territorial ones. There are also 7 national networks, and the national networks are different to the provincial sport support units. The national networks actually have operating funds, and they're less infrastructure. Their infrastructure is supposed to be through the provincial ones. There is a children and youth mental health national research network with some investigators in Alberta, both at U of A and U of C. Next slide, please. So as I mentioned in AbSpor 1.0, the funding partners were really Alberta Innovates and CIHR, but we had a lot of input from Alberta Health Services, Alberta Health, and of course the various universities, the research-intensive universities in the province. For AbSpor 2.0, because of less availability of funds from Alberta Innovates and no availability of funds from Alberta Health, we had to reach out, and that actually works out well because we have a lot more stakeholders, a lot more partners in SPOR 2.0, including, I'll highlight, WICRI and ACRI, and also the AHS-SCNs. So there's been significant resources invested in terms of in-kind support from WICRI, ACRI, the various SCNs and the DIMER, Data Integration Measurement Reporting or Data Analytics Group within Alberta Health Services, as well as the University of Alberta, the University of Calgary, the University Hospital Foundation, and through WICRI, the Stollery Foundation, and we still have a request pending at the Calgary Health Foundation. Next slide, please. So first thing that people often ask is what's patient-oriented research? So I wanted to dispel the notion that sometimes happens if people will hear about patient-oriented research and assume it just means patient engagement and patient engagement research. And really in Alberta, we've taken a broader view that patient-oriented research is really a continuum of research. Yes, it engages patients and or providers, but it focuses on patient-relevant priorities. So the kind of things that as frontline clinicians, all of us face day to day with our patients and with the healthcare system, and really attempts to bring evidence into practice to improve healthcare practices or policies, to improve patient outcomes, patient experiences, provider experiences, or the cost of care. Next slide, please. So everyone in the audience is aware of slides like this, that we know it takes 17 years from something that's shown in a preliminary phase 1 clinical trial to work to actually get into practice. And only 14% of the research that's ever tested in clinical practice actually touches a patient in the end. Next slide, please. This slide is just to emphasize that as frontline clinicians and as patients and care providers, there are millions of great ideas on how to improve healthcare and outcomes, and it really is the Niagara Falls when you're kind of thinking of it that way. But the number of things that actually trickle through and actually change practice in the end is very small. And AbSporU is about enabling people to actually bring those frontline ideas to fruition much faster. Next slide, please. So key point, AbSporU doesn't do the research ourselves. We help others do the research, and that's clinical research and quality improvement. Next slide, please. The second phase of ABSPOR-U, so for the next 5 years, really, we're focusing on 4 key components. And the one we're talking about today is the data science and research services. So we provide support for primary data collection studies, secondary use data studies, so using administrative health data, health economics. And we've actually got some funding from CIHR, and we've hired a couple of computer scientists to start doing some machine learning and some training on electronic health records and EMRs, like ConnectCare, which we all know and love, or those in the South will soon get to know and love. The learning health system is a big component of ABSPOR-U 2.0, and that's, again, led by David Johnson, Tracy Wasilic. There's also capacity development, so we're training the next generation and the current generation of folks how to do patient-oriented research, and patient engagement, working very closely with patients, patient groups, in both training patients to do research and actually helping bring patients into research teams. Next slide, please. I show this slide not to go through it, but to tell you that this is all outlined on the website, and it shows the kind of support that can be provided through the ABSPOR-U. Next slide, please. And I want to acknowledge, sometimes people say, well, I've never heard of ABSPOR-U. ABSPOR-U actually supported 1,201 requests in the first 5 years of existence. There was an independent analysis of ABSPOR-U done by CIHR before they could decide if we could apply for next year. And there was a 93% client satisfaction rate with the services. So it's something that's there, it's available. And we'd love to see more people from pediatrics make use of the resources there. I'm going to highlight on the far right of the screen we can talk about this in the percolator afterwards, but there are actually graduate studentships that are available, up to 10 per year, for individuals to train for a year and do master's training in patient-oriented research. Next slide, please. So everyone asks about access to data. That's what most people as clinicians are interested in. There is a distinct advantage in Alberta. Still, we have 56 provincial health data sets. So we have all the same data sets that Ontario has, BC, not quite as many as Manitoba, but a lot of good data sets. The ones that people are really interested in are the discharge abstract data set. So all hospitalization records since 1992 going forwards in the province for every individual linked by, and using their unique health identifier, we can link with outpatient visits, so physician billing claims. We can link with emergency room visits. We can, since 2008, we've been able to link with pharmacy claims, including for pediatric patients. That's important because if you go to other jurisdictions like Ontario, they can only link to medications for the over 65 individuals or people on social assistance. In Alberta, we can link to everybody. Increasingly, we can link to about 80% of the lab data in the province, and we're increasingly linking more of the diagnostic imaging data. So there's a lot of data available. There's also socioeconomic data available because we link to the census. We're not able to link to education files or justice files or social insurance files because those are separate ministries. But for the health data sets, we can actually link them for patients in Alberta. Next slide, please. This is just to show you that if you look at the orange in the middle there, those are research requests for data in Alberta. So you notice before 2013, it was incredibly rare for somebody to actually use administrative data in Alberta for research purposes. Since the establishment of the ABSPOR-U, that's actually one of the main thrusts of ABSPOR-U was getting those research requests. And you now see that most of the health data that's accessed for analysis purposes in Alberta is actually for researchers. Next slide, please. This is a slide showing on the left that about half the requests about 40% of the requests come from the University of Alberta, about 30% come from the University of Calgary, and the other 20% tend to come from AHS itself. So broad reach across the province. The more exciting slide is the one on the right. So for those who are around in the early, and I came back to Alberta in 1999. At that time, it used to take about 6 years to do an administrative data study. In 2015, when we first established ABSPOR-U, it took 186 weeks to get an administrative data study done. We're now down to between, at the time this slide was done, it was 3.4 weeks. It's up to about 5.6 weeks right now, partly because a lot of our resources have been devoted towards COVID. Next slide, please. This slide is just to show you that ABS4U is disease agnostic. So we provide support in any topic area, and it's really up to the PI who comes to ABS4U for support to dictate where the support, what the project's about. Next slide, please. Again, how to access the services, go to the website, click on data and services. There's information there, including a link to an Excel spreadsheet that tells you what the 56 data sets available are, what years, how frequently they're updated, and further hyperlinks to get into the actual variables themselves. But there's a lot of other information there as well. Next slide, please. This is just emphasizing the data and research services. So as David said, for Mincy, we provide support for investigators all the way from the research design stage to the actual crunching of data, provision of completed data tables, figures, etc. Next slide, please. It's actually a fairly simple process. There's a central web portal. You submit your request. We do, if it's a question or ask for a letter of support, then it doesn't need ethics approval. If it's an actual request for data, then there has to be ethics approval first. I will tell you now that it's a lot easier now to get ethics approval, both at U of A and U of C, for de-identified secondary use data studies, because there's a lot of comfort now that because the data stays within the AHS environment on AHS servers, and it's only accessed by SPORE data analysts who are cross-appointed to AHS, there's ethics don't have the concern, and AHS don't have the concern they used to have if people burned a DVD and took it home and nobody knew where the data was going. So once the request put in, it's looked at by case manager and Alberta Innovates, who confirms that it's eligible for support from the ABS4U, and then it's the resources allocated. Next slide, please. So what are the eligibility criteria? You just have to be an investigator from Alberta or the Northwest Territories, and you have to be asking for data from Alberta. We can't get you data from Ontario through the ABS4U. There is a second process that we can discuss in the question period called the Canadian Data Platform, which helps investigators reach out to other provinces. Our selection criteria, really we're looking for projects that are looking at clinical practice, improving clinical practice, or investigating patient or provider experiences. Next slide. And this is just pointing out that there's no requirement to include the data platform personnel as co-authors. This is the PI's work. We're just there to provide support. And up till the spring of 2021, it was free to access the data platform. We now have to go into a partial cost recovery mode, just recognizing the economic realities in Alberta. Next slide. I'll leave that slide and now turn it over to, that's just a slide giving you my email address if you have specific questions, or the general SPORE website. I'll now turn things over to Todd.
Thank you, Finley. Those of you who don't know me, I'm a pediatric nephrologist at the distillery, and I'll be talking on behalf of WICRI, really, and trying to synthesize a opportunity to, if you will, lower the barrier to accessing this data and completing projects as have been outlined previously. I'm speaking also on behalf of ACRI. Susan Vensler is kindly here, who is very supportive of this project. And so how do we operationalize what has just been articulated by Finley and by David? So next slide, please. So we created at WICRI and ACRI an opportunity, the Pediatric Health Outcomes Research Program. And so what it is a single point of entry, which will be at one of our institutes. We have a website at WICRI currently with the opportunity described in it. And so what it will do is two things. So we were worried that we were not capitalizing on this amazing resource, which Finley and others have created, and people in our department, and that there was a very timely two timely interventions. One was the introduction of Connect Care at the U of A and not in Calgary, so we have a parallel cohort. And there was also the intervention of virtual care. So we have these two sort of temporal interventions that were that occurred And we have an opportunity to ask questions using the data that Finley described to you to see how that affected the outcomes of our children or of our patients. So how are we going to reduce the catalyst and get more people trying to access this data and move it forward? So the first is, for those of you who haven't done projects like this, it can be a little overwhelming. And so we hope to either connect people or facilitate, as David said, and I'm happy at WICRI and others at WICRI are happy to help you jump through the hoops, fill in the paperwork to get access to the data. And facilitate getting access to the wonderful statisticians and data analytic people at either Mincys or Nabuspor locally. And Finley talked about, so you don't have to go through this opportunity. You can certainly work directly with Nabuspor, but there will be costs associated with it. If you access the data via the WICRI ACRI opportunity, that cost will be absorbed if you're a successful candidate by WICRI/ACRI, depending on the PI. So if we move slide forward, Tanya, I can show a bit more. So we also felt this was a good opportunity, since Dr. Bensler and myself are not native Albertans, to work together and put a program together where we can use each other's as either catchment areas as either to increase the size of our populations or as comparators, given the different timing of introduction of Connect Care and the bumps along the road with it. So we thought we would be better together and stronger together. However, due to the nature of our two institutions, you need a leader from both institutions for this opportunity, but only one can be the nominated principal investigator, because that will determine the access to the data, which is the identical data. You will get the same data. You will get the same analytics support if the nominated PI is in Calgary or if it's in Edmonton. It just means one goes through Nabuspor, the other one goes through Mincy, that's all. So obviously we're WICRI and ACRI, so the proposal that you will put together must address a child health outcome question, potentially due to a shift to virtual care or other change in the healthcare system that's occurred in the last 2 years, or previously. We've got Dr. McAllister has showed us what data exists there. So it has to be child health related, has to be deal with changes in healthcare systems. And then if we go to the next slide, please. We can talk about, so that's the high level, what you need. So somebody in Calgary, somebody in Edmonton to lead the project, and then a question. So what do you do? So the proposal is not going to be onerous. It's 2 to 3 pages. You'll have your specific question. You will have some level of methodology. If you need help with the methodology, please reach out. It doesn't need to be incredibly detailed, because when we talk to the data analytic people, they may disagree and have other ideas about the best way to analyze the data. So that's just to be clear. If you look at the website that Dr. McAllister referred to, you can see which sources you want to look at. Obviously, some resources, you may, in my case, if we're looking at nephrotic syndrome relapses, we may want to access the drug utilization database. And look at the number of times that someone's been prescribed steroids. If you're dealing with asthma outcomes, maybe you want to look at the number of hospitalizations or ICU admissions. And depending on the disease you're interested in, you will have to think of what the best outcome is, and therefore what database, but have an idea of which database you would access that data from. And I will ask Dr. Majasiks perhaps to comment at the end on where we can find the alignment with the hospital priorities. So what are the key areas within the hospital? I mean, this is a key area, improvement of outcomes. So I think it will qualify, but there may be specific ones you can get from the website, and the two hospital, the AHS leads can send us in that direction. And then really the rationale needs to be like, so how is answering this going to improve outcomes? Does it mean, there could be as simple as, well, we need to not deliver virtual care for these sorts of patients. But that should be thought through. How's it going to be translated? And then if you're not an expert in using administrative data or some of the data sets that have been described, who can, identify somebody who can help you, or if you need somebody, reach out to us and we can help identify mentors in the area. And so that's what you're going to need to apply. If we go to step 2, so we have a deadline for the application date, which is June 15th, 2021. Proposals can be submitted to tanya.both@ualberta.ca. There will be a joint group that will review the proposals and pick several to move forward, including from the 2 research institutes, Mincy, Spore, will all look at the projects. And then we're not necessarily looking at this as you won and win. If there's good ideas, but that need some refinement, perhaps there's a better way to do it. We're looking at it as an iterative project. You may get feedback and say, look, we're really keen on this proposal, but the way you've aligned it to us isn't going to work particularly well. Could you consider doing this? And so there may be some back and forth on that, and we encourage that. And so here's the website for the opportunity, which is on the WICRI website. So please look at it and think about it. If you have questions, reach out to us. And can we have the next slide? Okay, so once you have, as Dr. McAllister said, so once you have a proposal that has been either supported by us or maybe it hasn't, you need ethics. Having done ethics for administrative projects on multiple occasions, I can attest that it's actually the simplest ethics that I've had to do, including animals and randomized trials, is much simpler. It's actually reasonably straightforward. And then you need operational approval, and I always wondered why one would need operational approval, but it has to do with the legal release of the data. Dr. McAllister informed me this morning, so you do need operational approval. That is also really quite straightforward. Then that's it. Then we will move forward on completing the project with you. There will be no need to set up, go back to I think this is important. So although there is value to this, because you won't have to pay for the data analytics and you won't have to pay to access the data through this opportunity. So there is significant value, but money will not move from WICRI/ACRI to a PI's account and then to whoever, Mincy or Spore, in order to pay for the analytics. That will occur behind the scenes. So you can put on, you have been successful with this opportunity, and we can give you a rough cost you can put on your CV, so it will be a competitive award. You just won't have to deal with RSO in our institution or RSO and just, again, we want to decrease the barriers to accessing and moving projects forward. And if we move to the next slide, Tanya. And then, yeah, so once we have approved the project, you have ethics, operational approval, you go to your analytics, either in MyChild or with Spore, and then complete the data analysis, and then hopefully write it up. And with that, let's go to the next slide. We need to obviously thank our funders, both at the Alberta Children's Hospital Foundation, at the Story Children's Hospital Foundation, because without them, we wouldn't be able to, any of this wouldn't happen, this moving forward, and this facilitation of these research projects. And with that, I believe we have some thoughts, and we're open for questions or comments if people, I think you put them in the chat box, right? Is that how it works?
Yes, please. If you have questions, put them in the chat box, or you can raise your hand and we can reach out to you. Thanks very much. What an amazing opportunity, and I really hope that people take advantage of this because, as was said, it's prime time right now with during the pandemic. Things are happening between Connect Care here and just starting in Calgary. So really, really great opportunity. Thank you. Dr. Shaw said, thanks so much for the presentation. What are some opportunities for graduate students interested in learning about patient-oriented research, and who is eligible to apply?
So maybe I'll tackle first and just talk about the Spore U graduate studentships and then turn it over to Todd and Tanya. So within Spore U, every October, there is a competition that's launched. It provides support for 1 year for grad students. The person just has to be registered in a graduate program. It can be in data sciences, it can be in patient engagement, it can be in knowledge translation. And we ask that the applicant and their supervisor apply for the program. It's a competitive funding competition. We usually have 50 to 60 applicants per year. 10 are awarded, and the judging is done through Alberta Innovates. So it's a program that if you go to the Abs4U website, you can download the application form, and then you'll notice when you submit it, it goes to Alberta Innovates. Alberta Innovates has it judged by their panel of external experts outside of Alberta, who judge the top 10, and then those 10 are awarded up to $30,000 for 1 year. And there's actually very little restriction on the funding. As I say, it can be everything from data science and health economics all the way to patient engagement, qualitative research. So it's just the 10 best applicants. Abs4U doesn't judge the applicants. It's done by Alberta Innovates, by their external experts, like any other funding program. So there's no local advantage. And then that funding is available for 1 year. Preference is given to first year master's students, because it's actually tough to find funding for your first year of your master's studies. And that's it. The specific program details are on the website. And as I say, it's available every October.
I mean, WICRI does not have a specific patient-oriented research graduate studentship. However, we have and we will continue to fund patient-oriented research through the WICRI graduate studentship opportunity, which is available and will be adjudicated in May. So you still have time to apply should you be interested in an opportunity. That's if you're a master's 2 years or longer if you're a PhD student. So feel free to apply to that opportunity with patient-oriented research projects.
Thanks, Todd and Finley. I understand there's also some courses that the different SPORE platforms offer. For example, the KT platform will offer a shorter course if you're interested.
Yeah, so that's exactly right, Dr. Forgy. So again, if people go to the website, go under capacity development, and there's a link to, we have various offerings. So there's an actual graduate level course. It's a 500 level course that's offered obviously this year virtually. And probably next fall virtually as well, just because you can register at University of Calgary, University of Alberta. There are also a number of programs. There's a program around KT. There's a specific certificate in knowledge translation and the META program. There's one around data science as well, and there's one around patient engagement specifically. So there's a lot of educational opportunities available if people want to avail themselves of that.
Thank you. We have a question from Natalie Yancher. She says, I work with an epidemiologist in Quebec doing trauma outcome studies, including working with master's students that she may have. Can data obtained through Abs4U be analyzed by collaborators from other provinces? If not, is there a way to have access to Alberta data servers by non-Alberta research colleagues?
So one of the joys of working in Canada is health data is owned provincially. So the same way that Alberta data can't flow to Quebec, Quebec data can't flow to Alberta or Ontario. So unfortunately, because the data custodians are all provincial, and none of the ministers of health have signed off on individual identifiable data transferring between provinces, that doesn't happen. Realistically, although it'd be nice if it did, it's probably never going to happen unless they rewrote the Canada Health Act and changed the whole federal-provincial balance. Having said that, there's something called the Canadian Data Platform. So if you go to www.hdrn.ca, and again, there's a link in the Abs4U website, that's the basically link to a group, which is the data platforms from each of the provinces. So an investigator in Quebec can put a request through HDRN, which then comes through their process to Abs4U. The data would have to be analyzed within Alberta, so it would have to have an Alberta PI for the Alberta part. The data can be analyzed in Alberta. The metadata, so the aggregate tabular data, can be provided to other provinces. It's the same process we go through if we want to do an investigation on Ontario data. So we have that same thing. So there has to be, the Quebec investigator would have to have an Alberta co-investigator who'd be the PI for the Alberta part. the analysis is done within the Alberta servers, and the aggregate metadata is releasable, but not anything individually identifiable. And that's a legal requirement, nothing to do with SPORE, nothing to do with Mincy. It relates to the Health Information Act and the equivalents in the other provinces.
Okay, so I'll unmute myself. So it's Natalie Yanchar. Thanks for taking my question. So basically, because we are co-PIs on the proposed projects, I would just have to have, instead of her master student could not do the analysis, I'd have to have a master student here doing the analysis, is what you're saying, or contract the S4U analyst to do the analysis. But
yes,
she can be in, like, help with the guidance and discussions and Zoom meetings and.
yes, exactly. Yeah,
That's what I was thinking was going to happen. Okay, thank you.
Thank you. And Tanya has put the link to the hdrn.ca website in the chat box. And then Christina Hirota has also let everyone know that ACRI will be posting the opportunity for this pediatric health outcomes research program on the website soon. And she's linked back to Wickery. So hopefully those will all appear in both sites. Dr. Huynh has asked, these outcome research grants that require investigators from both children's hospitals, are they replacing the seed grants from Wickery?
No.
That was an easy answer.
Yeah, no. Those will exist in the capacities they previously had. This is, yeah, I guess you always ask where will cost findings be made so to make these things possible. And yeah, that's another conversation probably best had offline. But if no, the seed grants will continue to exist.
Thanks, John.
Susan, can you comment on the graduate student opportunities at ACRI, just so people know as well?
Yeah, thank you. I mean, we're all really excited about this program because we have a provincial healthcare system, provincial documentation, and I think we have fantastic partnerships across both children's hospitals and both research institutes. So we're trying to create a track record here. We're encouraging you to work together between the two cities because I think we all have the same agenda of advancing child health outcomes. I'm going to hand it over to Christina Hirota to speak about the specific opportunities, but I can just tell you that we this has been in the works for quite a number of months, and we're all really excited about it. And we're hoping we will have a large number of people that are getting together, thinking provincial, and using the fantastic data sources that we have here and the support infrastructure, both from the SPORE unit as well as here in Calgary, and the partnership to change outcomes or measure outcomes and then hopefully change outcomes for children and families. So thank you for the question, Todd. Christina, do you want to take it from here?
Sure. So if anyone is looking to apply to this opportunity, and it will be potentially a graduate student working on the project, ACRI does have regular cycles of graduate student stipend awards, and these are competitive awards, excuse me. And ACRI looks to support 50% of the stipend salary, and the other half would come from the supervisor, but these are ongoing competitions. They're always listed on our website, and I think I posted the Research for Kids website in the chat there, so that would be something that can certainly, again, add to your ability to complete this work along with that pediatric health outcomes opportunity, and then the links we have with the Alberta SPORE support unit. So there's lots of things in place that you can draw from to get the work done, and we're happy to support in whatever way we can.
Perhaps just one little shout out to the Department of Pediatrics here at the Alberta Children's. We also have funds that are jointly given for specific pediatric focus. So thank you all for partnerships.
Thank you. Dr. Majasik, I'd love to hear some of your thoughts because I know we had conversations around the frontline clinician and who should be applying and who should be thinking about this. So I was hoping to get your thoughts on that.
Thanks, Sarah. Yeah, I think this is a real great opportunity. I think with the implementation of Connect Care and our provincial healthcare structure, we actually have a very unique opportunity to really impact how we do our business. And so that is one of the reasons I wanted to see this come into reality is that the best people to ask the questions about what the impact is are the people who actually work with those patients, and to sort of see what changes do we make and how can we continually improve, but how do we then get the feedback for that without having to go through incredible, more difficult to structure research protocols for every single change we do, because some of the changes are more systematic, system-based changes. So we have some opportunities with Connect Care, we have some opportunities with virtual health, but we can also create those opportunities if we join with our colleagues. Alberta Children's Hospital and Stollery are the only two sites where we actually really provide tertiary, quaternary care and academic medicine in the more traditional sense for pediatric patients in the province. So we will have a provincial approach to this, and if we can join ourselves together and really ask the right questions, I think we can be national leaders in what we're doing in this. So I'm very keen to see this move forward. I think also what I think about as we do this is because it's a provincial database, some of the initiatives that we have are obviously that we should provide excellence and tertiary quaternary care at the two children's hospitals, but also that we should try to support care in the community and work with our communities. But we can now also get feedback on those types of data from how that actually happens and how it impacts healthcare through looking at the healthcare data rather than just surveys and things of that sort. So I'm excited about this. I think it should be great. I hope we get lots of uptake.
Thanks, Karina. Well, I think it was your vision and drive that got this off the ground. So thank you for that. Dr. Harley has asked if a PI could apply to use these data sources to justify, that is, get funds to hire rare birds like child psychiatrists.
No, I mean, this is not an ongoing opportunity to support salaries. This is an access to data and analytical data. So this is certainly if a child psychiatrist wanted to access the data sets, we would be more than happy to support a good project in that area. But this is not going to be ongoing funding to support any personnel. That's not this opportunity.
I would just add, in terms of the clinical delivery, that should be funded through Alberta Health Services and through your hospitals. But to look at what effect that clinical delivery has in terms of health outcomes should be funded through this.
Mm-hmm. Yeah, I think she was wondering about using the data to justify getting funds from somewhere else. But yeah, that makes sense.
Could you use the data to, I don't know, Karina, you are probably better to answer that. If we show that we have a gap, could we get you?
No, and I think that is exactly how the data can be used. I mean, it doesn't guarantee you get funds, but certainly if you come to ask for a clinical innovation or a clinical project where you have data showing that, it would be better outcomes if we could fill this gap, that goes a long ways compared to just coming saying, well, I'm tired of doing this, I would like somebody else to do it. In terms of getting somebody else, a psychologist or psychiatrist or somebody to work with us. So data always has a good role in terms of looking at where do we need to put our funding from the healthcare delivery system.
Sarah, perhaps I can add, if that's okay. This is also an opportunity to look at health disparities, to look at changes in models of care that we're facing during the pandemic. So it's not only within a particular population that you want to count, how many children have nephrotic syndrome. Sorry, Todd, but yeah, really, I think this is such a rich data environment that we have across the entire province, and I think we're all very passionate about being able to provide excellent care and measure our outcomes. So I think the sky is the limit. Start dreaming about what you really want to know and what you think will have the biggest impact for a patient population. It should include health disparities or changes in care models.
Thanks, Susan, for bringing that up. Actually, I think that one of the things I looked at or sort of jotted down here for priorities, one of the priorities is access. Who can access healthcare and where? And so if that's one thing that you want to look at from your population of patients, who accesses or healthcare where, that would be one of the things that we would say that this would be appropriate our good use.
Excellent. Dr. Yancher said this is awesome. If anyone needs a surgeon collaborator, to please call her. And I think the best sum up was from Jennifer McPherson, who said, really excited about the collaborative nature of this initiative. Children across the province will be the beneficiaries. Agreed. So Lynn has just posted the link to the percolator. So please join us, even if it's just for a few minutes. We'd love for our speakers to join us as well and continue the conversation and just connect. And Calgary, you are more than welcome to join us as well, because we love building these connections with you. Thank you, everybody, for joining us for Grand Rounds today. Thanks to our speakers, and thanks to all of you. And I hope you have a great rest of your week. Thanks, everybody.